Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So today we are in episode 2, that is arm abduction and nerve control in first aid series. Okay, so in this video we are going to break down the movement of arm abduction and how your body lifts the arm and the nerves and muscles involved at every angle. So before going the topic, we have to understand first what is abduction. Without knowing this thing, we can't understand this topic properly. Okay, so here, what is abduction? Arm abduction is a movement of the arm away from the body in the coronal plane. Okay, that means the movement of arm away from the body in the coronal plane. Okay, it's a complex motion involving multiple muscles will involve in various degrees. This is very important topic because with this topic we can easily find out that muscle problem, where in which muscle the tear and problem is there, and impingement and degeneration. So based on that muscle movement we can understand that nerve related problems also. Okay, so that's why this topic is very important, and that various degrees, and with various degrees that nerves and angle we can easily understands. Okay, so abduction degrees and control. So for this thing we have one mnemonic. That mnemonic is SAD SAT. S means first one, supraspinatus muscle. The supraspinatus muscle will work like arm abduction, will be like 0 degrees to 15 degrees, and this supraspinatus is innervated by suprascapular nerve. Second one, axillary nerve. Axillary nerve via deltoid muscle, you can see the movement 15 to 100 degrees or 90 degrees. If next one, D means dorsal scapular nerve. This dorsal scapular nerve, you can see that's innervated. The trapezius muscle is innervated by dorsal scapular nerve, also known as accessory nerve. Okay, it's very important. Maybe some people will get confusion with this name. Dorsal scapulary nerve, also known as accessory nerve. Okay, so we can see this with trapezius greater than 90 degrees of arm abduction. Next one, serratus anterior muscle is innervated by long thoracic nerve. You can see the arm abduction degrees, like the range of motion will be like greater than 100 degrees. Okay, so here for your understanding I am going to give first one, 0 to 15 degrees means easily we can tell that is supraspinatus muscle. Okay, if 15 to 90 degrees means that is deltoid muscle. Okay, if greater than 90 degrees means that is trapezius and serratus anterior. It will help for rotate the scapula also. Okay, so now this supraspinatus, that is suprascapular nerve, mostly it's from where it's coming means it's that roots are coming from C5 to C6. Okay, actually now the root coming from C5 to C6. Okay, accessory nerves, this thing we already know, that is cranial nerve 11. Okay, that long thoracic nerve we can see C5 to C7. Okay, so here In clinical, now I'm going to talk about clinical integration. In clinical integration, mostly, now I'm going to tell about clinical integration or clinical scenarios. In clinical scenario, first we can see the winged scapula. In winged scapula, we can see the injury of long thoracic nerve. When we can see this type of long thoracic nerve and winged scapula means if any patient going through the surgery of post mastectomy, that means removing of breast. Next are weak serratus anterior. We can see that is like medial border of scapula, so it protrudes when pushing against the wall. Okay, and second thing we can see, shoulder drop. When the shoulder drop will happen? When injury of accessory nerve, cranial nerve 11, so it affects the trapezius. We can it's seen after lymph node dissection, mostly lymph node dissection in neck surgeries. Third one, we can see some deltoid atrophy also. This deltoid atrophy happens because of injury of axillary nerve. It's this thing most common in anterior shoulder dislocation or humerus neck fracture, because from humerus that axillary nerve will pass. Okay, humerus neck fracture. So these are the things. So in this video, in this episode, we discussed what is arm abduction, and arm abduction involves, in conclusion and this summary I'm just giving in simply, like arm abduction involves a beautiful coordination between muscles and nerve. Understanding this not only helps with diagnosis in trauma or nerve injury, but also enhances some clinical reasoning also. Okay, so we discuss what is arm abduction, and we discuss some case scenarios and some degrees, muscle and innervation. So in the next episode we will start breaking down the upper limb nerve injuries, like beginning with some all nerves like axillary, musculocutaneous, radial nerves and everything. So stay tuned, like, share and subscribe. Take care. Bye bye. Thank you.